Hi, everyone. I hope everybody's doing great and staying safe. I know that y'all are just as tired of being at home as I am, but I think in the long run, it's going to serve us all very well. So, I am presenting the concept of inflammation, and this concept goes along with immunity and skin integrity. So, it all kind of comes together. So, hopefully, you'll be able to connect the dots as we go through. So, under this concept, we're going to look and explain the concept of inflammation. We're going to analyze the conditions which place a client at risk for inflammation. We're going to identify when inflammation is developing or has developed. We're going to apply the nursing process for individuals experiencing the inflammation process and response. Identify 5 cardinal sins of inflammation, contrast acute and chronic inflammation, and describe the inflammatory and reparative processes. So let's get started. Inflammation, in a very simple term, is the body's response to injury. So it can be different injuries. It can be mechanical. It can be like you've stuck a splinter or a thorn in your finger. It can be mechanical like that, or it can be chemical. And so we'll go into each one of those as we go forward. Inflammation defined is a complex, non-specific response to tissue injury, and it's intended to minimize the effect of infection, remove the diseased or damaged tissue, generate new tissue, and promote healing. So that's what inflammation is intended to do. As part of the innate immune system, inflammation dilutes, destroys, and gets rid of the necrotic tissue in the foreign bodies and agents such as the microbes, which are your bacteria, your viruses, and so on. Inflammation versus infection. Now, you can have inflammation, and is caused by a number of physical reactions triggered by the immune system in response to an injury or infection. Inflammation does not necessarily mean that there's an infection, but an infection can cause inflammation. So you can have something that's inflamed, like I've stuck a splinter in my hand. That inflammatory response happens, but it doesn't necessarily mean that I'm going to have an infection in that area unless some things are not working correctly. What are conditions which place a client at risk? So in our bodies and in our systems, the cellular injury is a disorder in a steady state regulation. That means in our body we are at a steady state, but the process is always ongoing. So any stressor that alters the ability of the cell or the system to maintain that optimal balance and to maintain that steady state can lead to injury. Causes of cellular injury, and we'll go over each one of these: hypoxia, nutritional imbalance, physical agents like temperature, radiation, electrical shock, mechanical trauma, chemical agents, infectious agents, disordered immune responses, and genetic disorders. So let's talk about hypoxia for a minute. So hypoxia is when there's an inadequate cellular oxygenation interferes with the cell's ability to transform energy. May be caused by decreased blood to the area, decreased O2 carrying capacity of the blood, decreased RBCs, hemoglobin, and hematocrit. Ventilation perfusion or respiratory problem that reduces the amount of arterial oxygen available. You can, of course, we're seeing this in the COVID-19 virus. So that's something that they have to look out for. And it may also be caused by the cell's enzyme system that make it unable to use the oxygen. So it may be a decrease to the area. It may be a decrease in the capacity of the blood because they've got a decreased red blood cells and decreased H&H. The usual cause of hypoxia is ischemic, which means there's a deficiency in the blood supply, seen in like an MI, a heart attack, or in strokes. Nutritional imbalances. So deficiency in one or more essential nutrients can cause that. Undernutrition, overnutrition. If you have obesity, it overloads the cell of the body with lipids, and it requires more energy to maintain that extra tissue, and obesity places a strain on the body, causing disease. Energy deficit leading to cell injury can occur if there's an insufficient glucose or an insufficient O2 to transform that glucose into energy, like we talked about in hypoxia. Lack of energy or inability to use insulin can prevent glucose from entering the cell from blood. That would be diabetes. Another thing when I think about nutrition, if you think about, have you ever heard of the anti inflammatory diet? According to the Mayo Clinic, these are the same things that they've kind of talked to you about: eating less red meat, eating more green leafy vegetables, um, decreasing the amount of sugars and things that you eat in your diet, exercising. So you want to make sure that you can, there is a diet that you can actually look up called the anti-inflammatory diet. Physical agents can cause an injury to the cells or the entire body. So temperature extremes, you can have hypermetabolism, increases the heart rate, the respiratory, the BMR, and that's heat stroke, like there's too much heat. Low temperature causes vasoconstriction, and the blood flow becomes sluggish, and blood clots can form and lead to ischemic damage of the involved tissue. So extreme temperatures like in Alaska or somewhere like that, there's a lot of extreme cold, so hypo temperature there. Radiation decreases protective inflammatory responses of the cell, creating a favorable environment for opportunistic infections. So, just for example, if you're thinking about a patient that is receiving radiation for some type of cancer, that's the reason that their protective inflammatory response of the cell has decreased. Therefore, they're more prone to infections and puts them more at risk for getting like the COVID-19 virus. Another physical agent is electrical shock. It produces burns and may stimulate nerves, leading to a fibrillation of the heart. So it can cause the heart to go into some crazy rhythms and cause them to have a heart attack. Mechanical trauma can result in wounds that disrupt cells and tissues of the body. So, getting hit in the head with a flying limb or anything that can puncture or wound the body, cause a wound for the body, disrupts things and can cause inflammation. Chemical agents like poisons, heavy metals such as mercury, arsenic, and lead can cause inflammation. Glucose, insulin, alcohol, drugs. So those are what they're talking about when they're talking about chemical agents. The severity of infectious disease depends on the number of microbes, the bacteria, virus, entering the body, their virulence, how strong they are, and the host's defenses. So if that host is their health, they're in good health, they're young, their immune response is good, then the severity of the infection may not be as much for them. But if there's somebody that's, say, 72, they've got chronic underlying disease like COPD, diabetes, anything like that, it can cause more of a problem for them because their body is not able to fight it off. And of those agents, infectious agents that they give examples of are the viruses. I keep bringing up COVID-19 because that's our world right now. Bacteria, fungi, protozoa. I mean, any of those things can cause some problems if it gets into the right spot at the right time in the right person and under the right circumstances. Disordered immune response is a hypoactive immune response, and immunodeficiency disease can occur. Hyperactive means it's hypersensitivity disorder occur. The immune response detects to foreign bodies by distinguishing non-self substances from self substances and destroying the non-self entities. Now, what does that mean? Let's think about that. So if something enters your body that's not supposed to be there, that's not of your body, then your immune response, I know that Miss Weston has gone over this, the immune response says, hey, look, there's an enemy in our world and we need to take care of it. So just think about those things like maybe having a lung replacement or a lung implant or a kidney transplant or something of that nature. That's the reason they have to take all of these medications prior to and after they receive the kidney transplant or the lung transplant, because your body automatically thinks, this isn't my lung, so I need to get this out. So it automatically starts trying to get rid of it. So basically, it's your own immune system that's damaging your own body's tissue, but it's doing it because it thinks that it's actually protecting you. Under the genetic orders, many of the defects produce mutations that have no recognizable effect, such as a lack of a single enzyme. Others are more obvious, like congenital normalities, like with Down syndrome. The reaction of the vascularized tissue to cell injury or death, like for example, bee sting, splinter, stepping on a nail, surgical incision, so on and so forth. Those are a reaction to that vascular tissue to cell death or injury, characterized by the production and release of inflammatory mediators and the movement of fluid and leukocytes from the vasculature into the extravascular tissue, meaning that it's going to come from out of the cellular, out of your blood flow and into the tissues. Inflammatory conditions are commonly named using the suffix itis. So like for appendicitis, inflammation of the appendix. Pericarditis, inflammation of the pericardium. Bronchitis. So you can see that anything with itis is some type of inflammation. So damaged cells can release inflammatory mediators. So you can have a local response. First, it goes from the vascular stage, and we'll talk about this, the vascular stage, and then the cellular stage. Then it can go to a systemic or whole body response, and then the white blood cell response comes into effect, and the acute phase response. So under local responses, we've talked about this before. If it's local, it's in one spot. So I've stuck myself with a thorn, it's going to be in that spot right there. But for some reason, if I stuck a rusty nail in there and I hadn't had my tetanus shot and so on and so forth, then what can happen eventually, if it's not taken care of, if I don't go to the doctor, if I don't take care of it, and the conditions are favorable, it can cause it to go systemically and go through my bloodstream and go through my whole body. So I wanted to take just a second and review vasoconstriction and vasodilatation. For some reason, people have a problem understanding constriction and dilatation. So if you look in the middle, that's a normal blood vessel. On the left is vasoconstriction. So it gets smaller, so it's harder for things to get through, like the blood to get through and stuff. Then vasodilatation is it's opened up so that they can rush in and take care of things. So when you first have the inflammatory response, you have vasoconstriction, just like immediately, because you think of something, sticking you, it's going to kind of shrink up and constrict, because it's like, oh my gosh. And then then all of a sudden it's going to vasodilate so that it can get the leukocytes and things that it needs to out of its cell wall and into the tissue to help combat it. Before we go into this, I want to stop that for just a second, and I want us to watch this.
Inflammation is the protective reaction of vascularized tissue to local injury. Acute inflammation is the early, almost immediate reaction of tissue to the injury, and it is the first phase of wound healing. Acute inflammation can be triggered by cell or tissue damage or by the presence of dead cells or noxious agents such as bacteria. Acute inflammation typically occurs before the immune response becomes established and aims primarily at removing the injury-causing agent and limiting the extent of tissue damage. Acute inflammation occurs in two overlapping stages, vascular and cellular. In the vascular stage, arterioles and venules near the site of injury constrict briefly, then dilate. Dilation promotes congestion, while an accompanying increase in capillary permeability leads to the movement of fluid into the affected tissue, resulting in the 5 classic signs of inflammation: redness, swelling, heat, pain, and loss of function. As fluid leaves the capillaries, the blood remaining in circulation becomes more viscous, it flows more slowly, and clotting occurs. The cellular stage of acute inflammation is initiated by the movement of phagocytic white blood cells, or leukocytes, into the area of injury. The leukocytes begin to adhere to the vessel wall, and then, in a process called emigration, squeeze through the wall and move into the inflamed tissue. The leukocytes wander through the tissue, guided by chemical signals in a process called chemotaxis. The cellular stage culminates in the leukocytes engulfing and degrading the bacteria and cellular debris in a process called phagocytosis. Products of phagocytosis, along with plasma and blood cells, form exudates, which accumulate, causing swelling and pain. Exudates are composed of serous fluid, red blood cells, fibrinogen, or tissue debris and white blood cell breakdown products. Concurrent with the events of the vascular and cellular stages, chemical mediators release bioactive agents that act to mediate the inflammatory response. Mediators are derived from the cells or from plasma. One of the first mediators of an inflammatory response is a cell-derived mediator, histamine, found in high concentrations in the mast cells of connective tissues adjacent to blood vessels, as well as in blood basophils and platelets. Histamine is released in response to a variety of stimuli and causes dilation and increased permeability of capillaries. Serotonin, another cell-derived mediator, performs similar actions. The 3 major plasma-derived mediators are present in the plasma in precursor forms that must be activated, usually by a series of proteolytic enzymes. The kinins increase capillary permeability and stimulate pain receptors. The clotting system traps exudates, microorganisms, and foreign bodies. The complement cascade causes vasodilation, promotes leukocyte chemotaxis, and augments phagocytosis. Acute inflammation comprises a variety of complex protective responses to injury that, together, lay the groundwork for the next stages of the body's recovery: immune response and tissue repair.
Sorry, I had to step away for just a second, but we'll get back to this. So, acute inflammation in the vascular stage. So, first you've got the vascular stage, and then you've got the cellular stage. And the vascular stage is when it's in the veins. Okay, so here it's talking about the vasodilatation. At first, you have a momentary vasoconstriction. And we'll go ahead and turn it back to that. Oh, well, okay. We'll get back to where we need to do. Learning this together. Okay. So what happens is once that vasoconstricts and then it's followed by the vasodilatation, it increases the blood flow to that area. And mediators like the histamine and the nitric oxide start putting out their They're chemicals. And then redness and warmth result in that. Now, then the capillaries become more permeable. That means within that vessel wall, if you saw it, when you saw it in that video, I think that video really showed and was very helpful to me. So I would go back and watch that again. It's in your ebook under your not the fundamentals, but your other med surge book. Capillaries, and you can find it in there, or you can go back and watch it on this. Capillaries become more permeable, meaning that those leukocytes can actually get out of the vascular phase and go into the cellular stage. The loss of fluids and increased concentration, like your leukocytes, platelets, and stuff like that. And then you go into the clotting, and I'm not going to go all back into this. And at this stage is where swelling, pain, and impaired function can happen. Because I've got a great little thing on the end I can show y'all. And then acute inflammation in the cellular phase, it delivers the leukocytes to the site of the injury. So how do they move to the site of the injury once they get out of the vascular? By chemotaxis. And I just kind of think of that as like a taxi takes you somewhere. So that chemotaxis is what's going to actually, once they get out and do the migration and the transmigration, they go to chemotaxis, and the taxi takes them to the site of injury. I know that's kind of weird, but that's the way I remembered it. So as you can read the rest of this because we've kind of talked about it. Okay. So the white blood cells entered the injured tissue, destroying the infectious organisms, whether it's bacteria or whether it's the virus or whatever that organism is that's come in there and invaded that tissue. And its job is to remove those damaged cells. So in the acute process, that its main function is to actually remove those damaged cells to promote healing. And if you look on the picture to the right, I kind of think of those white blood cells, those leukocytes, as little Pac-Man. I know I'm kind of dating myself. Y'all may not know what Pac-Man is. You can look it up or Google it. But it's this little game that we used to play, and it's this little ball-like thing that kind of looks like the picture on the right, and it goes through and it eats these little dots, and I kind of think of it like that. So it goes in and it eats that bacteria and release more inflammatory mediators to control further inflammation and healing. So this was a great way to bring all of this together, and it's real simple, so I would pay attention to this. It's disruption of tissue integrity, can be by injury, ischemic damage, immune reaction, and then you have your inflammatory response. And then it breaks it down on your vascular side. Vascular changes can be vasodilatation, increased capillary permeability, increased blood flow, local tissue congestion. Cellular changes, phagocytosis, leukocytes, increase, release of chemical mediators, and then your body's response. Your local effects of your 5 cardinal sins of inflammation. That means it's right in one spot, it's localized, and it's redness, warmth, swelling, pain, and loss of function. Systemic, then it can go systemic. The number one indicator that something may be going systemic is a fever. Remember that. Leukocytosis, malaise, which is very tired and you're just groggy. Anorexia, another thing, loss of weight. Loss of appetite, actually. Anorexia, so if it doesn't say anorexia, it may say loss of appetite. And then it can definitely lead to sepsis within the body. So this goes just back over the same thing that we've just gone over, so I'm not going to go back over that again, but it's another way to kind of look at it. I tried to give you several ways to look at it so that you can kind of figure out which makes more sense to you, because everybody kind of understands it a different way. I put this on here for the chemical substances released at the site in induced vascular changes, the histamines, the cannins, the prostaglandins. So read about that. Systemic response to inflammation is the inflammatory response is often confined to the site, causing local signs and symptoms. A systemic response can occur. Fever, again, is the most common size of the systemic response to injury. And this is caused by purinogens released from neutrophils and macrophages, especially these are special forms of leukocytes. Leukocytosis is an increase in the white blood cells and enhances the body's ability to fight off that infection. It's kind of like our little soldiers that go out and protect us. And also, general non-specific symptoms can occur, and those can be, like we just talked about a few minutes ago, malaise, anorexia, aching, and weakness. So what is acute versus chronic? Remember, acute is like right then. Chronic is over a longer period of time. So acute is a rapid onset, usually a short duration, can be a few minutes to several days, produces a protective function, removes the causative agent, and most importantly, under the acute inflammation stage, it causes healing. Its main objective is to cause healing to take place and to restore the body to its normal function. So that's what it's doing in that acute phase. Now, in the chronic phase, this, of course, remember, it takes longer. It lasts for weeks, months, or years, or maybe for the rest of your life. It just depends on what it is. It's non-beneficial, non-protective, and very debilitating. May result as a reoccurrent or progressive acute inflammatory response, or from low-grade smothering responses that fail to evoke an acute response. So basically, when it's talking about if it's something within your body that's so low of the inflammation is so low and it kind of stays kind of hidden underneath things, it can keep going and going and going and not ever evoke that acute response to happen. So it just kind of lays there and keeps trying to heal itself, or just pretty much just irritating things. Often associated with the proliferation of blood vessels, tissue necrosis and fibrosis, scarring. So I don't know if you know what a keloid is, but it's a scar that keeps healing over itself and over itself and over and over and over again for whatever reason. Not everybody has that problem, but some people do have issues where they have scarring and it keeps healing and healing, and it just becomes this big raised scar. And the chronic things like hepatitis B and C, it increases susceptibility to cancer. So it can cause, like the hepatitis B and C is the inflammation of the liver, and it can eventually cause cancer of the liver, or can cause cancer of the liver. Not saying that everybody that has hepatitis B and C will get cancer of the liver. So don't go and say Miss Jones said that. But anything that's chronic, like you've got, what are some examples of chronic inflammation? Arthritis, colitis can be something like, I have acute inflammation colitis. Now I don't have it all the time. Something that's more a chronic inflammation on the GI would be probably like Crohn's disease. So other things like obesity, diabetes, stroke, bronchial asthma, rheumatoid arthritis, and certain dementias like the Alzheimer's disease. So the inflammatory response is now recognized as playing a key role in both the contributing factors and consequences of these disease and altered health states. So the inflammatory response results in the formation of exudate, which drains from the wound. So when you have a wound and you all these things kind of build up, you get a scab is what we used to call it. And so this exudate is composed of fluid and cells that escape from the blood vessels and are deposited on the tissue surface. So there's different ways for a nurse or a healthcare worker to describe this type of fluid or this type of exudate. So, serous is watery fluid low in protein from plasma entering the site. Sanguinous is large amounts of red blood cells and looks like blood, but it can be dark drainage or bright red. Serosanguinous is a mixture of serum and red blood cells, light pink to blood tinged. And then you have purulent, which is pus, degraded WBCs, protein, and tissue debris. So this is kind of a good picture about the best thing that we could come up with. And it kind of gives you an idea. So when you're looking at the patient's dressing, is it serous? Is it clear? You can see it's kind of a pinkish tinged. B is purulent, which means that this kind of thick yellow, green, tan, or brown, and that looks kind of like pus, but it's called purulent. Serosanguinous is, again, remember, a mixture of your serous and your sanguinous, and it's pale red, watery mixture. And then you've got D, your serosanguinous, which is bright red, indicates active bleeding. Make sure you understand that serosanguinous is active bleeding. So when you're looking and changing, you've not gotten into dressing changes this semester, but you will definitely get into it next semester. So I wanted to make sure just to kind of show you this so you'll understand what they're talking about. Now, when we're talking about the reparative process, when does your body start trying to repair itself? So it begins at the same time as the injury. I mean, it's automatically, it's just right then. Healing proceeds after inflammatory debris has been removed. Healing occurs by regeneration or replacement. Regeneration, the defect is gradually repaired by proliferation of the same cells as destroyed. And I think I'm sure that Miss Latham or somebody has gone over wound healing with you. Replacement cells of another type fill the tissue defect and result in a scar formation and may occur by first, second, or third intention healing. And if you don't get that this semester, you'll get it in second semester. So applying the nursing process for clients experiencing the inflammatory response. So under assessment, early detection is key. Immunization status and previous or reoccurring infections. We need to know about that. Observe for local or systemic infection. Remember, if it's localized and what the symptoms are. What's the first symptom that you usually see if it's going systemic? Fever. Looking at lab work, seeing what the H&H is, seeing what the white blood cell count is. Making sure you look at that. Diagnosing. Some nursing diagnosis is risk for infection. Social isolation. So it depends on what it is. Like if it's the COVID-19, you've got to put them under some type of isolation. Patient can have anxiety with this. They can have pain with this inflammation, change in body image depending on what's caused this injury and caused this inflammatory response to happen. And fear. I mean, maybe they've had their leg cut off. I'm not sure, but that's just one of the diagnoses that patient can have because they don't know how they're going to heal. Outcome. These are the things that you want to plan for. You want to say that the client will demonstrate effective hand hygiene. The client identifies signs will identify signs and symptoms of infection. Maintain adequate nutritional intake. Use appropriate cleaning and disinfecting techniques. Under the nursing process, we would use sterile technique during the wound dressing change. And again, you'll learn how to do that in second semester. Definitely the number one thing to help that patient is to perform your hand hygiene. Take your vital signs to observe for signs and symptoms. Under evaluating the appearance of the wound, the appearance of the dressing for types of drainage. Remember, we talked about the serous, the serosanguinous, the purulent. Kind of see what that drainage looks like. And another thing when you're going into your dressings that you'll learn is you may make a mark, like if it's starting to have some drainage on the outside, not on the inside where you're putting it against the skin, but on the outside of it. I've taken a pen and marked the outside of the dressing to see how much further it's going out so that I can determine if it's bleeding or not, or if it's having more of drainage coming. And the relief of pain. So pain is a good way when we're evaluating the pain of the patient, and depending on what their pain level is, seeing if they have any kind of pain medication. So that actually ends the presentation on inflammation. This kind of goes along again, like I said, with immunity, and then it goes into Miss Latham's next lecture on skin integrity. So it all comes together. So I hope that you're able to put some of this together in a way that you can connect some of the dots. Y'all have a great night, and don't forget that you will have a post assignment, and that will be posted under your daily information. Y'all have a great day, and I hope y'all all the best. I hope we'll get to see each other soon.